Your menstrual cramp might be more than just a menstrual cramp. Stay tuned to find out why you're having severe pains during your menstruation. Welcome to All Round Health Talk with your girl, Dr. Onyinye. Remember, this is a channel where our health is our priority. Now, 80% of adolescents have pain during their menstruation, but 40% of these 80% have very severe menstrual cramps. Now, before we dive into today's topic, don't forget to hit the subscribe button and put on your notification so you get notified for every time I post a new video. Menstrual cramp or menstrual pain is called dysmenorrhea in medicine. Basically, this is the pain associated with your menstruation. It is the pain that appears before or during your period. Now, more than half of the women who menstruate have a pain that lasts from 1 to 2 days during each menstruation. This pain in most cases is mild to moderate, but in some women, this pain can be very severe. Aside this menstrual cramp that we experience during menstruation, it can also be accompanied by pelvic pain that extends to the leg and to the lower back. It can also be accompanied by diarrhea, nausea, vomiting, headache, and dizziness. Now, there are certain people, certain women that have a higher risk of having much more severe pain during menstruation. Who are these women? Number one, women who smoke have a higher risk of having severe pain during menstruation, women who consume alcohol, women who are overweight, women who started their menstruation earlier than 11 years old, nulliparity, which is women who have not given birth to children, women who have had a C-section that left an incomplete scar in the womb, and women who have longer and heavier menstruation. Now, there are two types of dysmenorrhea. We have the primary dysmenorrhea and we have the secondary dysmenorrhea. The primary dysmenorrhea is the most common type of dysmenorrhea. Basically, this is the menstrual cramp that starts from the moment a girl begins to have her period. Now, this primary dysmenorrhea is caused by certain chemicals produced by the womb. This chemical is called prostaglandin. Prostaglandin, what it does is that it causes your womb to contract. Every time your womb contracts, it restricts the flow of blood and oxygen to the tissues, and this causes pain. Now, primary dysmenorrhea tends to lessen with age. As you get older, it lessens, or as you have kids, primary dysmenorrhea lessens. Primary dysmenorrhea will usually appear during your period or a few days before your period, and it will reduce during the period and disappear after your period. On the other hand, secondary dysmenorrhea is as a result of an underlying disease or problems with your reproductive organs. Now, this secondary dysmenorrhea, it tends to get worse with time. Okay, so it will usually appear many days before your period. It will get worse during your period, and it will even last after your period. So if you're having this type of pain that appears 3, 4, 5 days before your period, gets worse during your period, and even remains after your period, you're having secondary dysmenorrhea, and it is as a result of different conditions, so you need to get checked out. Now, apart from this secondary dysmenorrhea that is a much more intense pain and lasts longer, it can be accompanied by pain during sex, bleeding in between your periods, and bleeding after sex. So pay attention to these symptoms. Severe pain combined with pain during sex, bleeding after sex, or bleeding in between periods is a sign for you to go see your doctor. There are many causes of secondary dysmenorrhea, but I'm going to give you 4 very common causes. Number 1 is endometriosis. This means that tissues of the womb, of the lining of the womb, are growing outside the womb. Sometimes they are growing in your ovaries, in your fallopian tube, or even on your bladder. But because these are tissues from the womb, they respond to the hormonal changes in the body. So when estrogen and progesterone are released during menstrual period and cause bleeding, those organs to bleed at the same time your womb is bleeding. So that is one of the causes. Another cause is fibroids, which are benign tumors that can grow inside, outside, or within the walls of the womb, causing pain and bleeding too. We have adenomyosis, which is actually the tissues of the womb growing within the muscles of the womb. This can also cause pain and bleeding. And the last cause I'm going to give you is pelvic inflammatory disease, which is mostly as a result of sexually transmitted bacteria that moves from the vagina upwards into the reproductive tract, affecting your womb, your ovaries, and your fallopian tube. This can cause vaginal discharge, pain, and bleeding. Now, if you have any of these symptoms that I've mentioned, you need to see your doctor. What will your doctor do? Your doctor will do some physical examination. They might do an ultrasound. They might have to do other imaging studies such as MRI, laparoscopy, or hysteroscopy. They will need to do a vaginal swab and a pap smear, but also they will need to test for human papilloma virus. Now, once you have been diagnosed of primary or secondary dysmenorrhea, what is the next step in terms of treatment? Now, you can take tablets for the pain. If it's not an intense pain, you can take analgesics like acetaminophen. If it is a much more intense pain, you can take anti-inflammatory medications like ibuprofen, naproxen, amongst others. But anticonceptives can also be used to control your menstrual cramps. Some of these anticonceptives contain estrogen and progesterone, like the pills, the patches, and vaginal rings. And some others contain only progestin, like implants and IUDs. So any of these anticonceptives can also be used to control your menstrual cramp. If you're not a person who takes medication during menstruation, then there are other methods that do not require medication. Like you can put a heating pad on your abdomen or a hot bag of water on your abdomen. The heat will help relieve the pain. Also, exercising, eating healthy foods that contain especially vitamins and minerals, and sleeping help with your menstrual cramp. In the case that you do not respond to any of this above mentioned form of treatment, surgery might be the next step. So if you're someone out there who has been struggling with severe menstrual cramp, this video is for you. But if you know some other lady who has been suffering from severe menstrual cramp, then share this video with her so that she can have more information about her situation. Don't forget to give thumbs up to show me that you like videos like this so that I can make more of these videos. Also, hit the subscribe button and put on your notification. That is very important so that we continue to grow our viewership on this channel. If you have a question or a comment, you can leave it in the comment section and I'll get back to you. Thank you for watching. I'll see you in the next one. Bye-bye.